I'm Dr. Rita Mcguire, the Chief Medical Officer here at Wakana. I'm one of the co-founders as well. I'm an obstetrician gynecologist of over 30 years. I can't believe it. I'm a graduate of Wayne State School of Medicine in Detroit, Michigan. I'm also a OB resident from Cook County. It's now called Stroger Hospital. I'm CEO of RJM Wellness and Rita Fitness. I'm also a global women's health and wellness speaker. I'm one of the physicians for the medical marijuana program here in Illinois, as well as the opioid exchange program, and a member for Doctors for Cannabis Regulation. So you can see that I am an advocate for the cannabis plant. So welcome to the Doctor's Edition. The Doctor's Edition is an edition on every Tuesday night at 7. Let's see, resume share. Karen, hopefully you can see the screen. You can put it in the chat. I think I paused it for a second, but put in the chat if you can see the screen. I would appreciate that. And welcome to the webinar. I'm Dr. Rita Mcguire. This is the Doctor's Edition, and I want to introduce you to the Medical Advisory Board. This is a board that is made up of healthcare professionals from every area of the healthcare industry. We have MDs, thank you, Karen. We have registered nurses, we have clinical psychologists, we have chiropractors, we have dentists, we have pharmacists, and we even have naturopaths. So all of these medical advisory board members are very instrumental in putting and weighing in during our conferences and our Zooms, but they are absolutely recommending our products to their patients, to themselves, and even their family members. So when we look at the cannabis plant, I must say that my colleague, Dr. Sanjay Gupta, is the reason why cannabis is truly mainstream. And the reason I say that is because in 2013, 2014, Dr. Sanjay Gupta came out and made a public apology to the world. You know, he said, I didn't dig deep enough. I didn't do the research. I didn't speak to professionals in the medical industry that were dealing with patients that were utilizing cannabis. And so he said that after doing his due diligence, after traveling the world, after looking at the research in other countries, after speaking with patients, that this plant absolutely has medicinal properties that every healthcare professional should know about. So Dr. Sanjay Gupta is really the reason why cannabis has become mainstream after years and years of having a negative stigma as it relates to medicinal benefits. So let's look at the plant, Cannabis sativa. It has two main species. One is marijuana and the other one is hemp. One gets you high and one gives you the health benefits without the high. So let's look at marijuana. It has high levels of delta-9 THC. Delta-9 THC is the compound that the plant produces that gives us the euphoria, the paranoia, and the high. It also has the ability to give health benefits like reducing pain and inflammation and anxiety. But the only problem is that it gives the patient, the person, euphoria, a high. It has psychoactive components that causes the brain and the central nervous system to give that euphoria effect to the patient. Whereas hemp has very low levels of delta-9 THC. It gives the person who's consuming hemp the health benefits they're looking for without the high. So when you walk into a dispensary a medical or a recreational dispensary, you are subject to buy products that are sourced from the marijuana plant. But when you walk into our dispensary here in Chicago, our Wakana dispensary, we'll talk about some of the product line. You are getting products that are sourced from the hemp species. So you're getting the health without the high. Now, what's also very important that you understand is that hemp has another component, and that is an industrial component where there's part of the plants like the stem and the fan leaves that are used for industrial products like textiles and fabrics and rope and paper. In fact, the very first Bible was constructed on paper that was made from hemp. The very first Ford automobile was constructed from hemp. In fact, the gasoline that the Ford ran on was processed from the hemp plant. So again, the difference between the two species is one, there's a high level of delta-9 THC in marijuana and very low levels. In fact, by definition, hemp is defined as containing less than 0.3% of THC. So when we look at the difference in the flowering of the plant or the phenotype of the plant, we see that the marijuana plant resembles a bush. It's typically shorter. It has leaves and buds that are surrounding the plant's body. But on the other hand, the hemp plant is very tall. It's very lean. The leaves are bunched near the top of the stem. So characteristically, they do have a different flowering, a different phenotypic look, as well as different climates that they can be grown in. We'll see indoor planting with marijuana and outdoor planting with marijuana and hemp alike. So the legality, though, of hemp is what's really, really exciting. See, prior to 2018, in order to get a CBD product that was sourced from hemp, that product had to be grown and cultivated in Europe and shipped here to the US. But in 2018, the Farm Bill was passed, and that allowed hemp to be cultivated, to be consumed and sold in all 50 states here in the US, as long as the amount of THC was 0.3% or less. And why that's exciting for healthcare professionals is that now we can finally do research legally on hemp in the US. So there's a lot of top universities that are now doing studies on ADHD, on a lot of autoimmune conditions, on a lot of seizure disorders, on a lot of conditions like hypertension and diabetes and heart disease. They're doing these studies looking at the therapeutic role of CBD sourced from hemp now in humans. Prior to that, we see a lot of data that is sourced from research that's done on mice, that's done on piglets and other animals. So now hemp is legal. It has been removed from being a Schedule I drug, which is a drug that has no medicinal benefits. It's a drug that has a high potential for addiction, and it has high safety profile. So now this is a legal botanical plant that can be utilized. The only FDA-approved prescription CBD product is Epidiolex. Epidiolex is a medication that's used for children that have seizure disorders like Lennox-Gastaut syndrome, Dravet syndrome, tuberous sclerosis complex, and this medication costs $3,200 a month. So it's a very expensive medication. It is a synthetically produced medication by GW Pharmaceuticals. And there's other medications that are approved in the US for nausea and vomiting, for cancer treatment patients. But again, these are products that are sourced from the marijuana plant. Syndros is a THC derived from marijuana. It is prescribed legally in the US. It's about $1,400 a month. Another medication, Marinol, again, derived from THC, marijuana. It is a medication that is also used for debilitating pain, cancer patients, and those patients who need assistance with cancer treatment and those symptoms that they may have. Sesame, another medication that is US approved for those patients who have debilitating disorders. Sativex is a medication that's approved in the UK. In the United Kingdom, it is a 1-to-1 medication, meaning it's 1 delta 9 to 1 CBD. But again, these medications are very expensive and they are typically sourced from the marijuana species. So why is it that so many of our patients are looking to use CBD? Well, they're looking to use CBD because they're on many medications and they're sick and tired of not getting the relief, the results that they're looking for. And they're sick of the side effects. So as healthcare professionals, I think it's very important that we understand how CBD works, how the science works in the body of our patients, and possible drug-drug interactions. So yes, our patients are looking to use CBD for relaxation, for stress relief, to improve their sleep, to relieve their muscle pain, to relieve their joint pain, to help treat migraines and many other issues. There is an increase in baby boomers, as well as Gen Zs and millennials that are utilizing CBD products. Each and every year, we see the increase in percentage of uses in all age groups and in all regions of the world. We see nurses. In fact, we have a lot of nurses and nurse practitioners that are on our medical advisory board. Nurses are utilizing the fact that they can recommend CBD to their patients who are looking for alternatives. We also are looking at and understanding that other paraprofessionals like doulas, like midwives, especially in my field of OB-GYN, they're looking for alternative for their patients that they are assisting with prenatal care, that they're assisting through labor and even postpartum. So let's look at what CBD does, or cannabidiol. CBD has a long list of properties that it can assist with, that it can address in reducing bacterial infections. It can help to reduce cancer cell growth. It's neuroprotective. It can come in and really improve those nerves that have been damaged due to stroke, Parkinson's, dementia. It helps to promote bone growth. A lot of orthopedic doctors are looking to utilize CBD as those patients who have had fractures or are recovering from fractures. It helps to reduce seizures and convulsions. Neurologists are utilizing CBD as an adjunct, as an additive, as another tool in the toolbox in those patients who are on seizure medications. It even helps to relieve pain, inflammation. It helps to reduce arterial blockage. So cardiologists are looking to help to improve blockage in arteries and helping to reduce cholesterol. Endocrinologists are looking at CBD because they know that it helps to reduce blood sugar levels. It even helps to be a vasorelaxant. So in those who have hypertension, heart disease, CBD can help to improve blood flow in blood vessels. The other cannabinoids, or compounds that the cannabis plant makes, are very important to synergistically work on a cellular level to help to reduce inflammation, to relieve pain. We see CBC also helps to inhibit cancer cell growth, to promote bone growth. Delta 8 and Delta 9 THC, and even THCV helping to reduce convulsions and seizures. So you can see that when we put them all together, that whole plant together, we look at the major compounds or cannabinoids that the plant produces, it really does have a synergistic effect on those cells. So the plant makes cannabinoids or compounds. Those are called phytocannabinoids. We talked about some of those, but let's look at what the body produces. Our body produces compounds just like the plant does. They're called endocannabinoids. And the two main ones are anandamide and 2-AG. And not only does our body produce these, but we find endogenous cannabinoids in dark chocolate, in beer hops, and even breast milk. So all of those patients that are breastfeeding are giving their babies the richest and the most beneficial cannabinoids that our body can produce, 2-AG and anandamide. So how does CBD and other cannabinoids work in the body? Well, there's a science called the Endocannabinoid System. It is a very vital regulatory system. This is a system we didn't learn in medical school, but just know the science is such that every mammal, every vertebrae has an endocannabinoid system. So not only humans, but dogs and cats as well. So the main receptors that our body possesses in our endocannabinoid system are CB1 and CB2. These receptors are important so that when we consume CBD, when we consume these products, they bind to receptors in different areas of the body, like the brain, the central nervous system, the liver, the lungs, the kidneys, the teeth, the skin, the pancreas, the reproductive tract, the uterus, the testicles. All of these main organs and glands in our body, when we consume these products, they bind to these receptors, and then they send a signal to keep the body in balance, or to reduce inflammation, or to reduce blood sugar, or to normalize a blood pressure. So this is the system on how, and the system on how CBD works. It's called the endocannabinoid system. There are other things that as healthcare professionals that we have to know as it relates to CBD, and that is, how does it interact with our patient's medication? Many of our patients are on medications. Does it cause an inhibition? Does it cause a potentiation? Because CBD is metabolized in the liver just as many medications are. So the CYP450 pathway is the way CBD is metabolized. So when we have patients that are on medications, that the metabolism is through this enzymatic pathway, we just need to monitor those blood levels a little closer. When we talk about drug screening is a very important question when our patients have random drug screens at their job. Now, there are products that don't show up in the drug screen. Those are your broad spectrum products or your isolates. But your full spectrum products are products that potentially could show in a urine drug screen. So when you're recommending topical products, those products that you use on the skin, those products do not pass the blood-brain barrier. So they will not show up in a drug screen. But when you're talking about a product that you are ingesting, a tincture or a water soluble or even an edible or a spice, these are products that potentially at high doses could be detected in a urine drug screen. So with that being said, it's recommended that you offer a broad spectrum, a product that contains less than 0.0% of THC, or you offer that patient an isolate. So the point of care, those urine drug screens that many employers use, those over-the-counter point of care urine drug screens are not very sensitive or specific, meaning that when those clients get tested, they could potentially become positive, even though it's just CBD. And the reason being is that many of these drug screens don't have the sensitivity to understand if the cannabinoid is CBD, is it THC, is it Delta 8? And so with that, we want to recommend LabCorp's drug screening that is very sensitive and specific, where it can tell the difference between if a person is utilizing a CBD product or if a person is utilizing a marijuana product. There's other things that you should know as a healthcare professional about CBD, and that is, where is the hemp grown? Is the hemp grown organically? Is the CBD oil extracted utilizing butane or propane or supercritical CO2 extraction or alcohol? The extraction process is important as well. Why? Because there is ways of extracting the oil from the plant that's cleaner in certain extraction process. Is there a third-party validation? Do the products have a certificate of analysis? How do we really interpret if the product is a product that's safe and effective for our patients? So choose a brand that stands behind their products. Choose Wakana. And we're going to talk about why Wakana products are products you should choose for your patients. Well, one is our products are extracted with a very clean method, which is a supercritical CO2 extraction method. There are different ways of utilizing CBD. There is a form called a tincture, which is an oral application. There are vape pens, there are liquids, water solubles, there are edibles, there are gummies, there are spices, there are capsules, and there are even topicals. So we're going to talk about ways that you can recommend and utilize these products, but just know that there are different forms of utilizing and consuming CBD because they have different onset of action, they have different bioavailability, and depending on the patient's need will really determine which route that you would recommend for your patient. So let's look at some of the studies. This is my colleague Ethan Russo, who in 2002 defined the clinical endocannabinoid deficiency. The clinical endocannabinoid deficiency is a real syndrome where we see certain people who have fibromyalgia, migraines, depression, have a deficiency in their endogenous cannabinoids. So this is a paper where he wrote utilizing cannabinoids, CBD, looking at the medications like Marinol and Sesamet we talked about, and looking at CBD in difficult to treat pain, like your sciatica, like your neuropathies, etc. Other studies looking at CBD as a potential treatment for anxiety disorders, as well as cancer treatment. Those who have nausea and vomiting, utilizing CBD to improve their nausea and vomiting. Looking at CBD in GI disorders like ulcerative colitis, Crohn's disease, reflux, GERD. Also utilizing a lot of these CBD research in really looking at long-term therapeutic uses in other disease entities. So PubMed is the source that you want to utilize when you're looking for different topics as it relates to CBD and the research. And again, more research is coming from UC San Diego and many, many institutions now that CBD is legal. So let's look at some of our products here at Wakana. As Chief Medical Officer, it is imperative that our products are tested, that our products have certificate of analysis. The FDA is not mandating that, but it is our transparency where our customers, our distributors, our business partners, our healthcare professionals can feel very, very confident in recommending these products to their patients. So our certificates of analysis are one-pagers. They give you the ability to look at the THC percentage, which it should be and always is less than 0.3% or less. It will also give the potency that is in the bottle. It would also give the results on mold, mildew, heavy metals, pesticides, residual solvents, and terpenes, of course, which are all pass. We have products, again, that are safe and effective and that are tested. Our FDA disclaimer: these statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute for or an alternative to information from healthcare practitioners. Please consult your healthcare professional about potential interactions or other possible complications before using any product. The Federal Food, Drug, and Cosmetic Act require this notice. So when we look at our tinctures are, again, full spectrum, which are our power tinctures. That means they contain a lot of those cannabinoids we talked about and the legal limit of THC. And then we have our pure tinctures. Those are our broad spectrum tinctures. Those are the tinctures that are in the white label that have the pure on them that you're going to recommend to patients who have random drug screens. Now, when starting out patients, you want to recommend tinctures as 3 drops in the morning and 3 drops in the evening. That is a nice dose to start. You can always increase that dose within 4 to 5 days if that patient is not seeing results. And again, tinctures are utilized twice a day because their duration of action lasts between 6 to 8 hours in the bloodstream. Now, they take about 15 to 20 minutes. Some patients get relief within a week. Some patients get relief within a day. Some patients, it takes a lot longer, but start low and go slow and then increase as needed. Now, our tinctures start at 500 milligrams. They go up to 900 milligrams. Our Hemp MD is that more therapeutic tincture. That's for that patient that has more of a serious challenge that they're looking at. But again, if you have mild to moderate conditions, you can start with our 500 milligrams or our 300 milligrams pure. We also have a water soluble. That is a great product for those who, I like using the Power Water Soluble and recommend it for those patients who have dementia or that person who has a cognitive disability where they're not able to hold the tincture under the tongue for 60 seconds before they swallow. That is a good way to utilize in those seniors, put it in their water, put it in their juice, put it in their tea, put it in their smoothie, oatmeal, whatever is liquid, you can put that product in. A lot of the topicals are utilized as well in those who have random drug screens. Remember, all of our topicals are power products, but they don't pass the blood-brain barrier. Topicals offer local relief. So our Extreme Power Pain Cream is our #1 topical. That is a product that can be utilized on the knees, on the shoulders, in the back of the neck, in the temporal area during a migraine. Our Power Liquid Relief, or our Dr. Rita's Rub, is another great topical that's in a roller ball that can absolutely be utilized for conditions like arthritis or lupus or fibromyalgia that will assist and address in the inflammation and pain. We have other topicals like our serum, our facial serum, and our power body cream that's assisting with symptoms due to psoriasis or eczema or even acne. Our edibles, our gummies come in our pure, which is our broad spectrum, and our power, which is our full spectrum. We have gummies that also contain Delta 8. Delta 8 is another cannabinoid that absolutely gives more potency than CBD for those who are looking for more creativity. Those millennials that are looking for less anxiety. Delta 8 is that product. And then we have CBD products that have been infused in our coffee. We have products that address weight loss, our CBD flat belly gummies as well. So we have edibles that really address all concerns, even libido, sexual dysfunction, stamina. That's our king of the jungle gummies. Our essential oils also are very, very potent. They are all organic. Our First Defense combines essential oils with CBD. It's a nasal spray where you can use in the nasal passages. That's where a lot of bacteria and viruses start to get into the host, get into the body through our nasal passages. These are products, again, that can be used topically. These can be used as aromatherapy. These are products that can also, some of them, be used internally. We use our smokables to address acute conditions within 1 to 5 minutes of using our CBD pre-rolls and using our Delta 8 pre-rolls and using our premium flowers, which will be back on the website. But just know smokables address those situations within 1 to 5 minutes. I recommend that you use and layer the products with your patients, that you utilize the tincture twice a day, that you utilize the topicals as needed, that you utilize the edibles, the gummies. You can utilize the broad spectrum gummies throughout the day and then the power at night to help that patient sleep. And then for those acute situations, the smokables, because they act within 1 to 5 minutes. Our culinary products are products that you can use to enhance those recipes. We have garlic fire, we have flavor king, we have chili lime. So these spices are infused with CBD. Our vegan butter also infused with CBD. Our Culinary Plus is a product you can bake and cook with, infused with CBD. We have a hair line, a hair care line, Save Our Strands, utilizing CBD. We understand the skin is the largest organ in our body, but you have to remember a lot of our patients have hair loss, hair thinning, even alopecia due to chronic conditions like lupus, like fibromyalgia, like diabetes. A lot of medications that we're giving our patients, those medications cause excessive hair shedding and hair loss. We have a hair care system that addresses, that assists, and can restore the hair. Our Royal Defense is our sister company that really was important to include during the start of the pandemic to keep our homes safe, to keep our offices sanitized. So we offer a hand and surface sanitizer, a produce wash for our fruits, our vegetables, our meats, and of course, masks for those who are traveling. Our sexual health is important. I just want to point out our CBD Lube for those women who have vaginal dryness, for those women who want to enhance their sexual encounter, be it because they have a loss of libido due to menopause, perimenopausal, or maybe some conditions like autoimmune conditions that cause sexual disorder. We have also a lot of information where again, using PubMed, utilizing CBD to lower blood sugar levels, to assist with those conditions that diabetics deal with, like neuropathy and those nerve damages, that nerve damage that can occur in our diabetics and our hypertensive, and also those who are battling with cholesterol, that are looking at issues that is causing atherosclerosis, coronary artery disease. We know that utilizing CBD as another tool, as we are helping to reduce those statins, we're helping to reduce that insulin dosage, and even reducing that metformin dosing. Utilizing CBD as another tool in our toolbox that we can offer as healthcare professionals to our patients. So there's so many great choices that you can't go wrong. I recommend that as a healthcare professional, if you're on the line and maybe you are not a healthcare professional, you joined this evening because you wanted to hear from a healthcare professional about these amazing products and how CBD can be utilized in so many different healthcare challenges, from anxiety to depression to cancer to diabetes to hypertension to heart disease to a lot of your autoimmune conditions. Yes, you can utilize CBD to assist, to address a lot of these symptoms. So thank you for joining. If you have questions, if you have concerns, I'll take some questions at this time. But my email is ritamd@wakana.com. You can always email me or message me at any time, ritamd@wakana.com. You may have a healthcare professional. You may be on the line. You may want your physician to connect with me. You may want your nurse practitioner to connect with me. You can share my email with them as well. I do want to also remind you at 8 o'clock in 30 minutes, we're going to have a business overview. So if you're interested in another stream of income, if you're interested in hearing more about the opportunity, if you're interested in hearing more about the products, join the 8 o'clock call, screenshot this slide. There's a Zoom ID and the passcode is there as well. So I'm going to take some questions right now. I'm going to stop sharing my slide. If you have questions, you can put the questions in the chat. What is the temperature gauge on the Culinary Products? 350 degrees Fahrenheit. Very great question. You don't want to bake or cook over 350 degrees Fahrenheit, because if you cook or bake over that degree, it will cause a very bitter taste in the food, and you will also cook away all of the benefits that CBD has to offer. And you don't want to waste your money, so you don't want to cook above that temperature. Great, great question, Toki Bird. Any other questions you can put right there in the chat? If not, you can join our 8 o'clock call. That is a business overview. You'll get more information about product line as well as the opportunity here. So the culinary products are a source of garnish. So the culinary products, the spices, can be utilized to season your food. And the Culinary Plus is another product that you can, yes, use as a garnish, or you can use to bake and cook, as long as you're not cooking above 350 degrees. Hopefully that answers your question. You can use it as a garnish. You can use it as a seasoning. You can use the vegan butter to butter your toast, to put in your oatmeal. Any recipe that utilizes the butter you can use, as long as you're not baking it over 350 degrees, because you'll bake all of the benefits away, and possibly it can add a bitter taste. Any other questions? You can put it in the chat. Hopefully I answered that. Toki Bird, put it in the chat if I've answered your question sufficiently. Wonderful. Thank you. Thank you. So if there's no other questions, we will in this call. Hopefully there's some healthcare professionals on the line. If you're a healthcare professional, thank you for joining. If you're a guest, thank you for joining. If you are a business partner, get those healthcare professionals on this line. We need more healthcare professionals to join the line on Tuesday at 7 p.m. Well, be well. We'll see you. Remember, our 420 conference is coming up this Saturday. You don't want to miss it. It's our 3rd year anniversary. We've got some amazing speakers. We've got some amazing products that we will be launching. Get your tickets today. Connect with the person that invited you so that you can get all of the information that you need to purchase products, to purchase your ticket for the 420 conference, and to be a part of this amazing company. So good night, and I will see you all very soon.